is Madison Turner, and I'm going to be demonstrating how to do a bed bath and personal hygiene for my patients. Alright, my name is Madison. I'm going to be your nurse for today. Can you tell me your name and birth date, please?
Christy Jackson, 7/15/72.
Alright, and I've provided my patient with privacy because the door is closed. Alright, I'm going to be giving you a bed bath today. Do you have any soap allergies or anything like that I need to know of?
No.
Alrighty, and do you wear contacts?
No.
Alright, I'm going to start by placing this bath blanket over you. Yes, if you would please hold it while I remove your sheet. Alright. Do you prefer soap on your face?
No.
Alright, I would then wet my washcloth, wring it out. Okay, I'm going to start with my eyes. Would you close your one, please? Okay, I'm going to go from the center to the outside, and then using a different part of the rag, I'm going to go from the center to the outside. I would then rinse the area and dry it thoroughly, but gently. I would then wet my rag, wring it out, and now I'm going to wash the forehead, the cheeks, nose, and the chin, and the neck area. I'm also going to wash the ears. Alright, I would then rinse and dry that area as well. But while I'm up here by the face, I'm going to talk about oral hygiene for my patients. When helping the patients brush their teeth, I would provide them with the toothbrush and the emesis basin. I would put toothpaste on the toothbrush and pour water over the toothbrush. We would then brush the teeth at a 45-degree angle, starting from the crown to the gum of the teeth. I would then allow my patient to spit in the emesis basin, and I would allow them to rinse with water, and I would also provide them antiseptic mouthwash to use for 30 seconds. And for cleaning dentures, I would first start off by removing the dentures with my thumb and index finger wrapped in a gauze pad. I would pull the top down gently, and then I would, for the bottom, pull up, move it downward a little bit, and then remove the bottom denture. I would place those dentures in an emesis basin filled with tepid water, and I would then clean those with a brush very gently. I would clean all the surfaces of the dentures, and then I would dry them. I would help, I would make sure that the water temperature I'm using isn't too hot or too cold, because this could really damage the dentures. I would then help my patient put their dentures back in, or some patients like to leave their dentures out to rest their gums for a while. And if they choose to do this, then I would put the dentures in a labeled denture cup. Alright, so now I'm going to wet my rag, wring it out, and apply soap. Alright, place this on your arm. Get my rag, soap on it. And then I would go up. I would then rinse rinse and dry the area thoroughly. I would then go to the nails and the hands. And I would then rinse and dry those thoroughly as well. And since we're here talking about the nails, I'm now going to talk about nail care for my patients. To do this, I would provide an Emerson basin of warm water. I would be sure to check the temperature, and then I would have my patients immerse their hands into that water for 5 to 10 minutes. But if I have a patient who has diabetes mellitus or anything like that, we would skip that step. I would then clean underneath the fingernails while their fingers are immersed. I would then remove the fingernails, dry them thoroughly, and I would then trim the fingernails, either going along with the curve of the nail or straight across at the end, like even with the finger. I would then file the nails, making sure that there are not any ragged edges or anything. Alright, I would then rinse out my washcloth, bring it out, and apply soap. Alright, I'm now going to clean underneath your arm, so if we can just put it back like this. Alright. Alrighty, and then I would rinse and dry the area thoroughly, and then I would apply deodorant. Alright, I'm now going to clean the chest area. Just lay this here. Alright. Get water and rinse it out and put soap. I will then clean the chest area, still giving the patient privacy. Alright, and then I would rinse and dry that area thoroughly as well. Okay, now we're going to move down to the abdominal area. Still maintaining the privacy of the patient. Okay, I would get my washcloth, apply soap, and I would then clean the abdominal area. Really looking at the umbilical area and any skin folds that might be there. Alright, we would then rinse and thoroughly dry that area as well. I'm going to move this back up. Alright, I would then raise the side rails to this side of the bed, and I'll go to the other side to then clean the other side. And with my soap and water on my washcloth, I would then begin to clean the arm. And the hand and the fingers. Right, I would then rinse and dry that area. Right, I'm now going to raise your arm. Alright, and get my washcloth with fresh water and soap. I'll then clean the arm this side. Alright, and then again I would apply deodorant. Alright, I'm now going to clean my patient's leg. I will move the towel in the middle, lift the leg to put the towel underneath. Alright, I would wet the washcloth, wring it out, and apply soap. Alright, I'm cleaning from the ankle to the knee, and then from the knee to the thigh. Alright, I would then rinse the area and dry it thoroughly, and then I would check the temperature on the water and make sure that it is still good. Alright, and then with the wet washcloth and soap, I will now wash the feet, making sure that I get in between the toes. And then I would rinse and dry the area thoroughly. And since I'm down here by the feet, I will now talk about nail care, but for the feet. I would provide my patient with a wash basin that has warm water in it. I would be sure to check the temperature. I would then have them put their feet in it for 5 to 10 minutes, but again, patients who have diabetes mellitus, they should not do this. I would then clean the toenails, clean in between the toes, and then I would trim the toenails. I would actually start off cleaning the feet by cleaning any of the calloused areas. I would then trim the toenails down, and then I would apply lotion to the hands or to the feet if they wanted it. I would make sure I would adequately rub it in, making sure that there's no excess lotion on the hands or the feet. Alright, now I'm about to raise this bed rail back up and get you back on the other side. Alright, I would then lower this bed rail. Alright, now I'm about to clean this leg, so I'm going to put the towel in between the legs. And I would lift the leg. Alright, rinsing out my washcloth and applying soap. Again, ankle to knee. And knee to thigh. I would then rinse the area and dry it thoroughly. I would then rinse the water off my washcloth and apply clean soap. I would then clean the patient's other foot, making sure I get in between the toes. I would then rinse and dry the area. Alright, if I could just get this towel from you, please. Okay, and now I'm going to roll you over on your side so I can clean or wash your back. Okay, we'll just hold the arm up like this. Make sure you stay covered. Alright, and on the count of 3, I'm going to roll you, okay? 1, 2, 3. Alright. So with my my rinsed washcloth and soap, I will now clean my patient's back from the neck down to the buttocks. Alright. I would then I would then rinse and dry the area. Alright, would you like a back rub today?
No, that's okay.
Okay, let's get you rolled back over. And then I would help my patient put on her gown. I would then remove and dispose of my gloves and apply clean gloves to clean the buttocks and the anus. So to do this, I would go from front to back, and I would clean and rinse and dry the area thoroughly. And for the male perineum, I would have them in supine position. I would provide privacy for them with the towel. I would first clean the thighs, and then I would dry them thoroughly. I would then expose the genitalia. I would start by cleaning the tip of the penis, and for an uncircumcised male patient, I would have them retract the foreskin and keep it retracted. Whenever washing the penis, we would use circular motion from the center to the outside. And I would continue to do this using a different washcloth each time until the penis has been cleaned. I would then lift up the scrotum and make sure to adequately clean that area. I would rinse the areas and I would dry those areas. For a female patient, I would have her in dorsal recumbent position. I would also provide her privacy, starting with cleaning her thighs, and I would also dry her thighs. Some agencies say to rinse and dry the thighs, and then some just say completely just dry the thighs without rinsing. I would start by spreading the labia majora, and I would clean each side very well. I would then use a different towelette each time, and we would use the front to back method. I would then dry the area, and that would be all. I would then remove and dispose of my gloves and perform hand hygiene. Thank you.
We did it.
Yep. Are you done?